What about those people, and you've heard them, everybody asks you, filler migration. Is my filler gonna migrate? If I get chin filler, is it gonna move around? Is it gonna migrate? What do you think of those people? Does it migrate? Did you see it migrate?
Has my cheek filler migrated over the last 6 years? You tell me.
So that's pretty good.
Are my cheeks still there?
They're there.
Okay, and I'm a side
Has mine.
sticker. Thank you.
Wow.
I don't know, and there's a lot of fear mongering behind that one. What was it? An MRI?
Yeah.
I would love to see what that girl looked like with.
Yeah, you're right. We never
I
saw her
would
face.
love to see what the face actually looked like, because that was a crazy a crazy image that we saw. And I personally, I don't know. I haven't seen it where the filler actually grows over time.
Sure.
I don't see that.
No, not really. I think if you're doing like tons and tons and tons of filler, nobody says no to you.
Yeah. And who's injecting the same area every year?
Yeah.
This is when migration happens. So I don't know, that's my take.
I agree. Okay, this is controversial.
Oh.
There was one junk study. I mean, it's not really a study.
Okay.
But they looked at people who got chin filler, and then those
Why haven't I
same
seen
people.
this?
I don't know.
I'm scared. Send that to me.
I'll send it to you.
Okay.
And I wanted to bring it up on the fly. So they injected these people with chin filler, and only at one syringe. 2 years later, several years later, these same people decided to have an implant. So they looked, and like 9 out of the 12 patients had bony erosion from the filler in the same spot where they had the filler. What do you say to those people? Because you can get bony erosion from an implant too. Both things can happen. So I've had patients say, hey, if I get filler or an implant or whatever, is my bone gonna get eroded away?
Okay, well, no, I actually have never heard of that. But if you're saying that it can happen with both, then it's gonna happen regardless.
Yeah, so I say if you have an implant there, or even if you have filler and the bone erodes a little bit, like,
no big deal.
No big deal.
Add a little more.
Add some more. Make it look better.
Right, especially if 2 years pass and we need a little touch up, no big deal. But that's why I love chin filler.
Right.
Or else I'm not trying to go in, cut it back up, replace it. The other question I have.
Yeah.
Are you slicing and dicing that implant in the OR?
So that's a good question. You can. So there are pre-made implants, there are customized implants you can get. I generally use the pre-made ones because I think they look nice, and there's multiple different pre-made ones. But if